Good morning, everyone, and welcome to this exciting day for us at the FGM European Network. My name is Toksokeni, and I'm the president of the FGM EU Network. I'm very thrilled to be with you this morning with so many high-level speakers to launch the very first map on laws, policies, services, and data collection of FGM in Europe. Thank you so much for being here. It is great to see so many of you. And also, before we go into the agenda of today, and while we are waiting for others to join us, I would like to mention some housekeeping rules. We have had a little bug on the system. Please, as you come in, can you kindly rename yourself so that we know who you are and you are clearly identified. So first and foremost, this webinar is being recorded and is also being live streamed on Facebook. So please, if you do not wish to appear on the recording, keep your camera off, change your name as guest, and only write your interventions in the chat box. Kindly mute your microphone and put off your camera during the presentations and when you're not talking for internet stability. Also, please write your questions or ask for the floor in the chat or through the raise your hand button, and we will make sure to give you the floor during the Q&A sessions, both in the plenary as well as in the breakout rooms. I'm sure by now, after a full year of webinars and online meetings, you are all quite used to this announcements now. We will be in plenary. I'm going to quickly go through the agenda program for today. We will be in the plenary for the first 50 minutes. We are after hearing some introductions and introductory remarks from the Secretary of State for Citizenship and Equality from Portugal. We will present to you officially the online interactive map. After the presentation, there's going to be a short Q&A. We will then have a breakout for 1 hour into two parallel rooms to dive deeper into a few specific subjects that would showcase promising practices from European countries and we hope would spark some debate. You will be able to choose on the spot which breakout room you want to take part. Finally, for the last 40 minutes, we will come back to plenary where we would hear some key takeaways from the parallel sessions, and we will end the morning and the event by hearing some concluding remarks by the head of the Gender Equality Unit in DG Justice of the European Commission. Now, before we start this full program for today, I would like to briefly give the floor to our lovely Anna Whitewing, Director of FGM European Network, for some welcoming words. Over to you, Anna.
Thank you so much, Tox, and good morning, and thank you to everyone for being here. I am so thrilled to that you have all joined us today, and I'm sure this morning will be incredibly interesting and very rich, as you have heard. Today, on the International Day for Action for Women's Health, we want to shed a light on all actions and measures put in place here in Europe to prevent female genital mutilation from happening and to support survivors of the practice. It has now been over 2 years that the entire network has come together, and the End FGM EU Secretariat team, as well as board, has conducted a thorough research in 14 European countries on laws, policies, services, and data collection around FGM, and have put them all together, which has resulted into an interactive map, which you will all have the chance to see today. We will see today the culmination of this massive collective network effort as our map is finally going live, and we are so thrilled. We hope that the map will not only serve as a source of information, but also a source of inspiration to do better and continue to improve our work towards ending female genital mutilation and our support of FGM survivors in our region. Before kicking off, I would like to take this opportunity just to thank a few people. Of course, to begin with, I need to thank everyone who was involved in this research. It has been a massive collective effort from all corners of our continent. So big thank you. In particular, a big thank you to all of our members for their expertise, without whom we would never have reached this result. I'd also like to thank the board for their strategic guidance throughout this process. And of course, the past and present staff who have worked so hard in making this interactive map a reality. And at this moment, I'd like to give a special shout out to Chiara, our head of policy and advocacy, who has really worked tirelessly on this for the last 2 years to make it happen. I'd also like to thank our president, Tox, for guiding us through the morning today and the event, our ambassador Aminata, as well as our board member Hayat, who will be facilitating the breakout sessions. And a special thank you to the Portuguese presidency and the European Commission for agreeing to open and close the event today, as well as the many member states representatives who will be sharing some promising practices that are done in their countries that are also showcased in the live map. Without further ado, I will pass the floor back to Tox, who will continue guiding us through the day. I hope you will enjoy it, and thank you everyone for joining.
Tox, you're muted.
Apologies for that. I don't know how many times we've heard you're on mute. Thank you very much, Anna. And now, without further ado, I'm honored to give the floor to Rosa Monteiro, Secretary of State for Citizenship and Equality, for our opening remarks on behalf of the Portuguese Presidency of the Council of European Union. Please, Ms. Monteiro, the floor is yours.
Good morning, dear all. I will first like to say thank you for the kind of invitation that to congratulate the End FGM European Network on this launch event of the first and important interactive online map on FGM in Europe. This is a unique opportunity to promote mutual learning among European countries and to build knowledge while highlighting promising practices and encourage mutual sharing and exchanges. It is also a moment to reaffirm our collective commitment towards combating female genital mutilation that limit access to rights to health, well-being and self-determination, and this is a form of gender-based violence. It is a violence and a violation of the human rights of girls and women. And in Portugal, we have been persistent with this commitment and in our efforts over time. Indeed, Portugal was the first EU country to ratify the Istanbul Convention. And last April, in the scope of the Portuguese presidency of the Council of the European Union, we organized the high-level conference to mark the 10th anniversary of the signing of the Istanbul Convention, and to stress that this is the roadmap for a Europe where all girls and women will feel protected and safe. Therefore, it is deeply important to see the Convention as the tool that makes it possible to define the required guidelines for a common protection based in all the member states. Ongoing efforts are made to adopt and adapt national policies to ensure its effective implementation, also in Portugal. Legal changes have been crucial on criminalizing forms of violence against women, such as FGM, and making FGM punishable even if it is committed outside the country. Further to this, action on the ground has been prioritized, ranging from providing specialized training to professionals of various sectors, to create a specific funding for civil society organizations, to launch in 2018 a unique program on eliminating FGM named Práticas Saudáveis, in which we created a network, a real network of healthcare and education professionals, law enforcement, child protection, judges and prosecutors, and civil society organizations to engage with communities to protect those at risk and to bring support also to survivors. And through this public program, we can now count on a larger team of qualified professionals and a significant increase on the record of cases of FGM on the registration system that we have in the past 3 years. Our strategies must also be based on a culturally sensitive outreach and consider an intersectional approach with attention to gender inequalities and those based on racial and ethnic origin. And with that in mind, in the last month, we have inaugurated the first 2 offices to support migrant and refugee women victims of gender-based violence and harmful practices, FGM and child, early and forced marriage, at the National Center or National Support Center for Migrants Integration in Lisbon and in Porto. Furthermore, the Portuguese government assumes the work with civil society, proximity and articulations as hallmarks of its strategy. Therefore, the implementation of the policy measures regarding FGM framed within a strategic area of our national action plan against domestic and gender-based violence is supported by a working group that brings together all relevant entities from government to NGOs. However, and despite this, our best efforts, there is certainly still a long way to go and improvements to be made. And in this process, the way communities and society think these issues is also fundamental and crucial for our intervention. Prevention is essential and relies on a sustainable transformation that can only be achieved by calling upon and engaging everyone, from local communities to leaders, media, and society at large, to raise awareness, to disseminate valid information and support, to dismantle misconceptions about FGM and FGM affect communities. Debates and campaigns are instrumental to do this, and education and training are actors at the center of any transformative strategy. And this leads me to address that putting a strong emphasis on empowering girls and women of FGM affect communities is the utmost importance, as well as giving voice to survivors and community-based activists. In this connection, along with our joint work together and toward eliminating FGM, we must also continuously denounce and challenge the root of all forms of gender-based violence and the discrimination that women continue to suffer in all dimensions and across their lives as we aim to change the social norms. And this initiative today is fundamental to shed light on what needs to be done and what can be done to build knowledge, to instill action, and to produce change. While girls and women continue to be victims of FGM and at risk of FGM, we cannot afford to sit back. We have a duty to act and to face the challenges ahead, strengthening the victim support services and protection systems, increasing the knowledge, data, and recognition of this form of violence. And let me conclude by stressing that all these actions will only produce real transformation if they are addressed as a collective and shared responsibility. Thank you so much for your engagement, and I wish you great success and fruitful discussions this morning. Thank you.
Thank you very much, Ms. Secretary of State, for those important words and insights and for being with us today. We really appreciate that. And now I have the pleasure to pass the floor to Chiara Consentino, our Head of Policy and Advocacy at the End FGM European Network. She's going to bring us, to the heart of our event today, the official launch of the very first online interactive map on laws, policies, services, and data collection around FGM in Europe. The map is going live today, and Chiara will guide us through it and show us how to navigate the tool and its main features. During the presentation, please feel free to write questions you might have, and you can put this in the chat. I would make sure to post them to Chiara afterwards. So Chiara, over to you.
Talks, and thank you to the Secretary of State of Portugal for those indeed inspiring words, and thank you all for being here today. So yes, this interactive map on FGM in Europe, as also Anna was mentioning, was created by the End FGM European Network together with our members to provide a useful centralized resource available and accessible to anyone interested in better understanding the situation on FGM in Europe in terms of laws, policies, services, and data collection in the 14 European countries where we have our members, where our members operate. Why did we decide to do this? As an European umbrella working on ending female genital mutilation, our expertise and bird's eye view is highly valued by many stakeholders. And some of the most frequent questions that we get are, for instance, what is the situation of FGM in Europe? Which country is doing best in terms of training for professionals or funding for FGM, or where can survivors access holistic supports, or including reconstructive surgery, and so on and so forth. And while we do some thematic work on specific issues with our members, such as mapping asylum practices and laws or support services for survivors, we produce, of course, materials and reports on those, we did realize that actually our expertise on many issues, many different issues, and our European overview was basically only available on demand. And so this is why we decided to embark in this 2-year long journey with our members and share the richness of our collective knowledge on the respective countries' systems around FGM with a wider audience. So this map really aims to create a centralized, accessible and available source of information around FGM in Europe, to function as a resource center and a knowledge platform on FGM in Europe, and to especially encourage countries to improve and to advance their laws, policies, services, and data collection by reviewing the evaluation that we made of their practices and learning from one another through an easy-to-use comparative tool. And finally, highlighting promising practices by different countries and encourage mutual sharing and exchanges on those. Who are the main targets? We had in mind, when we did this work, we had in mind 3 key target audiences. And of course, the first one is policymakers, exactly for the aims that I just shared. We do want to reach those who make decisions, both at European level and at national level, and also those who can influence such decision-making around FGM. We, of course, also want to share these results with professionals and make them available to professionals in a broad sense. So everybody who wants to look at an in-depth information or specific data to support the professional work around FGM. So these, of course, are our members, other civil society organizations, researchers, academics, and any other relevant professional in any sectors, health, asylum, and so on and so forth, who would be interested in knowing more about FGM in specific countries or as a whole in Europe. And last but absolutely not least, the concerned population, meaning definitely communities and survivors of FGM, or in general, people who are looking for information to find services in their countries and to figure out even how to contribute to ending FGM. So I would like to walk you through a bit the methodology that we used. So between 2019 and 2020, and FGM EU conducted, together with our members, as we were saying, a thorough mapping in the 14 European countries where our members operate. Information has been collected systematically and homogeneously through a standardized questionnaire, so to ensure comparability among countries and to be able to promote improvement and mutual learning at national level. The questionnaire explored 4 key areas that we are always repeating, so law, policies, services, and data collection, through 19 questions on many issues, among others, criminal law, extraterritoriality of the application of this law, asylum, national action plans, protection measures for persons at risk, funding on FGM, community engagement measures, healthcare services, including reconstructive surgery, where it's available, professionals training, and also prevalence and risk studies on FGM, and many more. Each of these 19 questions was posed in the same exact way to the 14 European countries and had a standardized 2-layered approach that you can see here. So the first answer is a color-coded answer and intends to give the overall picture of the situation in an immediate way and very visual way. And you can see it here, for instance, in the training of relevant professionals. This is a screenshot from the map, and you can see all the possibilities of answers at a first to the question, are professionals trained on FGM? But of course, complex questions cannot have such clear-cut answers. And therefore, to add a layer of complexity, while still keeping as a priority the comparability of answers, we added a section when needed for further details to nuance with some concrete existing challenges or just further details the main answer, the color-coded answer. And you can see an example, for instance, of the training of relevant professionals in France on the right. And you can see there are tags, which are categories that are still standardized to ensure comparability, but are different on every country. And of course, both these 2 standardized questions have the possibility to add in the map additional 3 qualitative narrative answers to just give further explanations and really to picture the country context. This research was first conducted at the NFGM European Network Secretariats level, so in Brussels for desk research, and then it was validated and cross-checked by our national members and other relevant experts at country level. So now, how is the map? How is navigating the map? So the map has been designed to have 4 reading levels. The first and most immediate one, which is visible consulting the online map that I will show you in a second, allows for a quick and visual understanding of the situation as a whole. The second level and more in-depth one, which is clickable when selecting a country on the map, gives a more narrative explanation of the map with a more detailed content. The third and the comparative level, which is available both per topic on the map and for all topics at once when we select the Compare Countries button, gives the opportunity to have a general overview of how countries are doing in comparison to one another. And lastly, the fourth level provides a direct spotlight on promising practices at national level, which is available either directly on the map or by selecting the Good Practices button. And now, without further ado and explanations, I would like to share with you the map. So just give me a second. Yes, so welcome to the NFGM European Network map. This is the landing page. And so the map can only be consulted by starting to select a topic, as there are in reality 19 maps because it's one every topic. And so, yeah, you can select the topics from the drop-down menu that you see here. And for instance, let's take as an example one of the policy questions. You can see here there are all the 19 topics divided by the 4 areas that we wanted to highlight. And let's, for instance, take the question on whether there are multi-agency coordination mechanisms dedicated to tackling FGM at country level. So as you can see, there is an overview that you see immediately of the issue at European level, and it's quite evident. There are some countries that have fully functioning interagency coordination mechanisms and are the green ones, such as the Netherlands, Portugal, Sweden, and Finland. There are countries that actually do not have at all these mechanisms, such as Ireland, France, Switzerland, Italy, Greece, Cyprus. There are others where it depends on subnational level, such as the UK, Belgium, and Spain. And there is one country, like Germany, where there is such interagency coordination mechanism, but is actually not active. We can see, and you can see here on the map, that there are 2 countries with promising practices. You can see it from this tick. And to explore them further, you can even click, for instance, on the promising practice, and you will, on the country, and you can go to read more to read this promising practice. Or you could go on the menu and check the good practices page. Now, you can see here, for instance, you can see either all of the good practices at once, or again, you can select the topic. And for instance, I will show you the same topic that we were seeing before. And you can see Portugal. So the 2 good practices that you saw on the map, you can see Portugal and the Netherlands. And after every good practice, you can see that there is an explanation on which are the elements that we, together with our members, consider to make it a promising practice. Another way to explore the map, and now let's go back to the map, which can be done in an easy way on the button that you just said that I clicked, and which is visible every time that you are not on the map. So another way to explore the map is to go more deeper in per country. And so let's take another example on the topic. For instance, we go on the services and we select holistic healthcare services. So here we can also see what I was mentioning of the 2-layered approach to every question. So the first color-coded level, again, as we saw also before, gives us the overview of the situation in Europe and captures whether all mentioned services in the question, which is psychological, sexological, and gynecological care is available for survivors. So it analyzes whether these services are available at country level and if they are covered. So if they are covered either by health insurance or by the public system for survivors. So you see that there are 3 possible questions here on the right, and that they are actually pretty much equally distributed on the map among the different countries. However, of course, this gives just the surface of the issue, and the user can go to different countries to see for more detail. So, for instance, if we click on Italy, you will see another window coming here, which provides a snapshot of this specific topic on this specific country. And it is really a sort of synthetic photography of the national situation on access to healthcare services for FGM survivors, which it's still on a comparable way with other countries. You could see the differences and the similarities with other countries. If you wanted to have more information, you could go on the read more question, and you would go immediately to the holistic healthcare services part of the Italian country page, where you could have, as I was mentioning, all the narrative of all the limitations and all the color-coded answer that we set. Now, this is the first way of accessing the map. You could also, if you wanted, instead of starting on the map, so on a topic-focused search, you could also search just for the countries, and you could do so clicking this button on the country list that you see here, and you can see all the list of the 14 countries that are mentioned here in the map that we studied, and you could select indeed one country. For instance, we can select Spain. So you see here, if we select Spain, and then we can either see all the topics one by one by scrolling down, or we could also select the topic that we want to see, again, as we do on the map. So, for instance, let's take the National Action Plan. You could go directly to this and check all the narrative. What another feature on the country pages is also to highlighting promising practices, and you can do it through ticking this box. And in this case, it will only show for that country the promising practice, as you can see here. By this symbol, you see that this page, all the country pages are also printable on a PDF, or I mean, you can print them as well, which is a user-friendly way of downloading them. And there is also the possibility, if you go up with an arrow, which is again an easy way of scrolling up because it's quite long, you can see that every country all the information is available in English, but then is also available on the language. We translated it on the language of the country, and it is a downloadable PDF. So you are also able to ease accessibility at country level. As you can see here, every country page has also a date stamp, which allows us to know when was last updated this information. And this is why, because it is a living tool, it is really something that we continuously update. And every time that we have information or that we get information from users, we will update the map to make it up to date. And you can see how to do that. You can see this very nice button here that follows you while you scroll down. This is the do you have any questions or contribute button, and it will bring you to the contact form on the page where you can just tell us any comments or any further information that you want to give us. And finally, another feature, another way of consulting the map is through the comparing countries page. So this is a feature that it's very important to us because it really serves the purpose of comparing and sharing, the situation on different countries and really learning, ensuring a mutual learning. So in case you wanted to compare two specific countries, you can select them all actually, but that maybe doesn't serve really the purpose. So you can select 2 or more countries. And for instance, we can select 3 we'll select Cyprus, Ireland, and Sweden, for instance. And you can see here, if you scroll down, all their approach on all the countries on a comparable way. So this is really easy to use because it looks really at the overall approach to tackle FGM and to support survivors, and looking at all areas and seeing differences or similarities. And of course, if you click on the for instance, if you click on the respective area, the map will bring you exactly to that country page and to the specific topic on that. So this is the end of the presentation. There is a lot of potential and possibilities, and we do hope that this map will serve, as Anna was mentioning, as a resource of information, but especially also as a source of inspiration to do better and to continue to improve. And we really want to encourage mutual learning towards ending FGM for all in Europe and beyond. And we do hope that this will be a small contribution towards that goal. So thank you very much, and enjoy. Back to you, Tox.
Thank you so much, Chiara, for your very articulate and eloquent presentation of this fantastic and innovative tool to all of us today. We truly believe that it will serve many decision makers, professionals, civil society actors, activists, community members in all of our countries and beyond, to have a better overview of the situation in Europe and to learn from one another to improve how to tackle FGM and support survivors in our region. And before I continue, I just wanted to make a small announcement. Could you please kindly rename yourselves? In order for you to do this, you can click on the participants list. You'll see yourself on the very top, or wherever your name is, you will be the very top, and click on more, and then rename to your own actual name. I will continue now. There are a few questions for you, Chiara. The first question is, who participated in the interview? Was that a policymaker or a researcher from a specific country?
Thank you for the question. It really depends from country to country. We did work together with our members. So actually, as I was mentioning, the first desk research was done at Brussels level, but then the validation and the cross-checking of all the information, that all the information was correct, was done by our members. So they are the experts at national level, and they are the ones who validated and provided all the further details and corrected also things that we had wrongly understood. So it really depends on from country to country how our members wanted to, even if they didn't have the expertise themselves, they would go, for instance, for specific issues and ask to legal experts or to asylum experts or to professionals in, for instance, multidisciplinary centers for survivors. So it really depends. It's really on a country by country basis. Sometimes, indeed, we did also consult authorities, so to have further information. But not only. It was really a collective effort of many experts, but mainly really from our members, whom again thank you so much for all your work on this.
Thank you very much, Chiara. There are a couple more questions, which I think we probably have time to go through. The second one is there a partner in Greece? We received only some clarification questions by your end of institutional level, but no further information.
Yes, so we do have a member in Greece. Our member is Diotima, so they are an NGO indeed working on research, but also on service provision, training for professionals and raising awareness. So yes, we do have we do have a member in Greece, and everything has been done through indeed our members. And then of course, if our members couldn't have access to all the necessary information, because as you can see, it's quite detailed. So even if you're an expert on everything, you can also miss some key or yeah, small things. And so we try to reach out also to broader audience in case our members couldn't address all the questions that we had.
Thank you. And the third one is there a possibility for members to adapt information on the map, or is this done by NFGM?
Yes, so basically how it works is that the members, I mean, if there is any change or anything that is not represented, that it will change, yes, so they can come to us and tell us the information, and we will make sure to adapt it in the map. So it is we have control over the back end basically of the map, but yeah, anybody can contribute, and we will be absolutely gladly adapting content and any information based on, of course, what our members say, and also other experts. But we will first cross-check it with our members because they are the main ones owning this.
There's a fourth one. The questions are now coming in their groups. There's the fourth one that says, brilliant tool. Do you have plans to update the tool to include other countries?
Absolutely. So as this is based on where we have members, as soon as we get members in new countries, we will definitely adapt the tool and broaden the scope. And for instance, we just were joined by a member from Malta this month, which is amazing. And so we will definitely have new information next year, hopefully on Malta to be added. And if we get other members in other countries, that will definitely be a way to go and to update the map with further and more countries. We want this to be as comprehensive as possible, but as I was saying, it is based on where our members operate. So it will depend on that.
Thank you very much, Chiara. There are lots of people saying, you know, impressive tool, great tool, congratulations. Congratulations, it's an excellent resource. And another one, brilliant tool, fantastic tool. Many congratulations on its launch. It just goes on and on. The map looks amazing. It was a pleasure to participate and provide information from Finland. Special thanks to Chiara for your tireless assistance in the process. So I think that those are the questions we have so far. And so I'm now going to continue. I don't think there are any other questions. I'm just checking to see. Oh, there's another question. Congratulations on a fantastic and useful tool. As data is updated, will historical and past data be available?
That's a good question. So we do have, of course, all the versions, the versions that are now published. We do have them in our archives, but this is definitely a good point. I think that it would be very useful to do that. So thank you for the suggestion. We will for sure keep record of the progress, let's say, so to show really over time. I think that's a very good suggestion. Thank you so much. And yeah, we'll definitely take it into consideration with further changes in different countries.
Thank you so much, Chiara, for your amazing, tireless pursuit of this work. Yeah, and as Anna said earlier on, 2 years in the making with so much, you know, I mean, this is amazing. Thank you so much. So now we are going to move on. If there are other questions, we will look at them later or respond to you in the chat. We're now going into our breakout sessions, and we want to go into exploring a bit more in depth some of the sections on the online interactive map that Chiara just presented. And we want to do so by breaking into 2 parallel sessions, 2 breakout rooms, looking at specific topics for about an hour. The true sessions would have the objective to look deeper into a few specific subjects and see how they are dealt with in the different European countries, including showcasing some promising practices. And also in each room, there'll be short presentations from national authorities, which will be followed by a discussion among countries and a debate with the audience. You will see in a minute popping up on your screen the choice between the two breakout sessions, and you would need to select one. And then the one you would like to attend, and then you can join that virtual room. But before we go into that, I just want to explain what will be taking place and we'll be talking about in both sessions. So here we go. Room 1 would be community engagement and protection for persons at risk of FGM. This will be meaningful engagement and conversations with communities and protecting those at risk. And these are two key elements to end FGM, including also in Europe. However, this is practically done, how this is practically done varies obviously greatly from one country to the other. And so while some states have put in place promising measures, some others are lagging behind and they're playing catch up. This breakout session will feature some promising examples from the Netherlands, Portugal, and Germany, and will be moderated by our amazing FGM EU ambassador, Aminata Ba. In room 2, funding and data collection on FGM. In order to end FGM survivors, adequate funding and data collection is key. However, they are often lacking. Some countries have found ways to fund work around FGM in a sustainable manner, while others have established national FGM registers, including those on asylum cases, and have also funded prevalence research, which promise to close such gaps. This breakout session will feature some promising examples from Finland, Portugal, and Belgium, and will be moderated by my fellow board member and FGM EU Secretary, Hayat Traspas. So really, the choice is now yours. Please select and join your preferred room, and you will see, and I'll see you back here in about an hour. In a few seconds, you will see the rooms being beamed out to you.